Hey, Michelle, this is Mary Beth. Can you hear me?
I can.
Okay, well, you can hear me, but I can't hear you, so I gotta work on something. Thank you.
You can hear me though? You heard me just talk though?
Uh-oh. Michelle, could you say something to see if if I can hear you now?
Hi, Mary Beth.
Oh, good, I can hear you. Now I just can't get my.
Awesome.
Thank you so much, Michelle.
You're welcome.
Hello. This is incorrect.
Good afternoon, everybody, and welcome to the August 10th Human Services meeting. It is 12 o'clock. We'd like to call the meeting to order, and first item of business is the approval of the agenda. Just need a motion and support to approve the agenda. Mr. Baer, Mr. Kennedy, thank you very much. Any questions, comments, concerns, additions to the agenda? Seeing or hearing none, all in favor say aye. All opposed say nay. The agenda passes. Next item on the agenda is public comment. Do we have any public comment today?
No public comment.
Thank you very much, Michelle. Brings us down to the next item on the agenda. Next item is going to be the approval of the July 13th Human Services minutes. Mr. Kennedy, seconded by Mr. Baer. Thank you very much. All in favor say aye. All opposed say nay. All right, takes us down to item B. Item B is appointments for human services. We have no applicants, but plenty of open seats on the Sanitary Code Board of Appeals. Just for clarification, the MELF seat that keeps coming up, I was nominated from the floor and appointed to, I believe, 2 meetings ago. So I just at least wanted to put that on record that appointment has already been filled. And unless there are any nominations from the floor for the Sanitary Code Board of Appeals, we will move to the next item on the agenda. Mr. Plesky.
Mr. Chair, I just want to make, I'm going to make known to my township and village officials that these openings exist and see whether we can't scrub up some interest in that. Just letting commissioners know that I'm trying to do that. It's kind of obscure, but I'm going to give that a try.
Thank you very much, Commissioner. I also think it may be a good idea for us to reach out to the gentleman who was the applicant that we accepted and nominated to the committee last month and see if maybe he knows of some other individuals who may be a good fit for this particular board. So because this board's been pretty vacant for a while. So I think any tips on who we can look for to appoint to this committee would be great. All right, anything else on the appointments? If not, then I'll move us to item C. Item C is the Lifeways monthly report.
Okay, so I'm on here. Hopefully you can all hear me.
We
This
can
is
hear
Mary
you, Mary
Beth.
Beth. How you doing?
Hey, I'm doing good. My only problem is I can't get the camera on, so I guess you don't get to see my face today, but I apologize for that. I sometimes have technical problems when you kind of bounce back and forth from some of these. Oh wait, it has asked you to start. Somebody asked, maybe this will work. I got something came up, sorry. Maybe this will work. Start your video. Well, no, it didn't work. So we'll just move on. So I do have in the in your packet this month's Lifeways report to the county commissioners. A couple of things have happened since I produced the report. I'd kind of like to talk about those first, and then I'll cover the report. First thing that's really exciting is the fact that, and you've heard me talk about it over the last several years because it's been in our strategic plan for a long time, around the fact that Michigan Senator Debbie Stabenow passed a Mental Health and Excellence Act back in 2014. It began the process in 2015 of creating what's called Certified Community Behavioral Health Clinics. It allows for organizations, community mental health across the nation to be able to have some of the expanded and integrated health delivery models. At the time, only 8 states were selected. Michigan had applied, but was not selected. I'm happy to report that the Michigan was one of the states. They selected 2, Michigan and Kentucky, to be expanded states for the Certified Community Behavioral Health Clinics. This is long awaited as an organization. We've done a lot of work over the last several years around integrated health, around our partnership with the Federally Qualified Health Center, and our work with the county, and around creating the 24/7 crisis continuum. And this aligns our agency to be ready for this next step. So it is pretty exciting. A lot more to be known as the state determines how they're going to roll that out, but I will definitely keep you appraised. But very excited that this has occurred. And that we just learned that last week. An update about the building remodel. So as you know, we've been under renovations over here at Lifeways. It's a 3-phased process. The first phase of the building is actually completed. We moved staff in over the last 2 weeks and started services today, actually. And the 2 areas of the building that have been renovated are the medical services area, the area where we have psychiatry, and we have embedded primary care. So now the Center for Family Health is actually embedded into our nursing and our psychiatry services and not just co-located on site. The other area is our case management and supports coordination. That area of the building has renovated. The next phase, and they started the demolition today, is for the crisis unit and the access services, where they do the autism testing and outpatient services. So that's the next phase of the renovations. The other thing that we're heavily involved in and will be presenting to our board this month is our annual budget planning for fiscal year 21. I think like many service organizations and even counties like yourself, there's a lot of unknowns about our budget for this next year. You know, with the anticipated projected revenue sharing to be at a loss of about 6 billion statewide, you know, Lifeways is being proactive and really looking at ways in our budget for this next year to reduce our administrative budget. In some areas where the reductions have been anywhere from 2.5% to about 12%, depending on the department. We do plan for provider reductions in the event that we have to do that. If we experience a significant impact in October, we really want to prevent that as a last resort, having any kind of impact on services to the population that we serve. But we are, I can't imagine how there won't be some impact to community mental health across the state with such a loss in revenue sharing. So I'm sure that that is something that you are very involved with in planning as well in many organizations across our community. So those are 3 things that were not included in your report, but I did want to kind of share that. In the report, I did talk about the status, about where we are with our planning with COVID. We have had 25 individuals that we serve tested, and 14 of them have come back positive. 8 of them live independently. 2 were at the Center for Forensics, and 3 were at the Hillsdale Medical Care Facility, and only 1 in a group home. So we're still really happy that we took action right away to kind of, if you will, secure the group homes to ensure that we didn't have any of that within the group homes, because that's a very vulnerable population who have very, many of them have comorbid conditions that this could significantly impact our services with that population. So that is where we're at. We are at tier 2. We had hoped in July that we would have moved to a tier 1, but unfortunately we started to see some cases increase, and our response plan, which was built based off of the CDC as well as feedback from the local health department, we have to be 30 days with a continued decrease of cases in order for us to move back to a tier 1. What's important to note is that at tier 2, we're still doing on-site services. There are crisis services being provided. Uh-oh, somebody's feedback's on. We are still providing on-site services, and people can request either telehealth or on-site, whatever they are most comfortable with at this time. I will also share that the services that we're providing via telehealth, those services, while there was an initial kind of ramp up to get people used to using those services, it is at a pre-COVID rate. So the level of services we were providing prior to COVID, we're back in that same level of service delivery. We are seeing increase in crisis services and requests for utilizing our crisis going up prior to pre-COVID. And like I had shared before, that is anticipated if you look at what happens with national disasters and the need for mental health treatment after something like that occurs in a community. But we have been able to divert people and be able to still utilize services like our mobile crisis services and our crisis residential to try to keep people out of inpatient as much as possible. Those numbers are starting to go up as well, but still not at the level that they were prior to the COVID pandemic. The other thing that's included in your report is an update relative to some of our goals around recruitment and retention. And happy to report there's been a lot of significant improvement around retention. In 2018, we were at 68% retention. We are now at 95%. I think a lot of that is contributed to things that we've done to really strengthen some of those service areas that had the high turnover, and that's in the area of crisis. I mean, if you know anybody that does that kind of work, it is very, the secondary impact for individuals that do that work is very, very hard on them. And most people last about 5 years at tops. And we're doing things to provide clinical training, stress management. We've increased supervision, everything we can do to strengthen their skill set and to provide the support. And we're seeing positive outcomes as a result of that. The other thing that we've seen is our turnover has gone from 10% in 2018 to 2%. Again, another good thing that we like to see as an organization. And wanted to share that with you. The last thing that I kind of wanted to touch on, because I'm not, at this point in time, is a lot of unknowns as we anxiously wait to see where the state goes with this. So in your packet, you'll see the information about the Michigan Crisis and Access Line. The state is calling it the MyCal. And what that is, it happened in April, in the middle of this COVID. Michigan Public Act 12 was created to develop a new behavioral health integrated call line. And really what this is intended is several fold. It is intended to be a crisis line, one line across the state of Michigan that would be staffed 24 hours a day, 7 days a week, that they wouldn't just provide crisis, but they would also provide warm line. And warm line means like a peer, somebody that has lived experience, informational services, and that's like connecting individuals with things like 211, social determinants of health screening, and what are the resources in the community, as well as connecting the community mental health with a platform for our annual audits and certification processes with the department. So it's pretty ambitious. As a community mental health, I'm anxious to know how they are intending on pulling this off across the state. Every local community mental health has a 24/7 crisis line, as well as the fact that you have your 211 call center, and you also have the national hotline now, the 988 number. So I worry, but I'll be anxious to hear and have reached out to request to be part of the work group to know how they plan to roll this out, to connect with community mental health, not to create a duplication of service, and how to streamline the process. Now, there's a potential that this could actually create savings to a local CMH if the state covers this cost and doesn't take the funds away from the CMH. But there is much yet to be known about how this actually will be implemented. But I wanted you to be aware of it in the event that you hear about it. I do know when the state, during the COVID situation, they announced a warm line statewide. And we shared that with our local JCAN group that was pulled together to address the pandemic that was happening here in Jackson. And it created a lot of confusion for people. And I'm worried that this might do the same, but I'm going to be optimistic that we can work together with the state to make improvements on the system. So kind of stay tuned. They got a pretty high endeavor to have this operational by October, and they just got vendors submitted. So we'll see how that goes. With that, that is the last item on my update. Now I will turn it over for questions of any of the county commissioners.
Thank you very much, Mary Beth. Commissioners, what questions do we have? Sorry, I've got a couple questions. I'm just trying to get my kiddos back out the room for a second.
It's all right.
First of all, thank you for the update on the building. I was actually going to ask that. I'm kind of intrigued to see the difference. I know that place is like a maze on the inside, so I hope it's a little better.
Oh, you're gonna, yeah, you're gonna love it, Daniel. It's really, it's a nice facility now.
Well, good. I'm really happy to hear that that's made some progress. I was also very, very happy to see the action that you guys took on the governor's executive order and your plans for. Sorry, I'm trying to pull my your report back up from my phone. Your plans to develop or start looking into what implicit bias training your staff is going to be taking. I just think that's awesome leadership and initiative on your part to proactively be looking into what you can do from your reign to stay in line with what the state and what direction change is going in. So I really appreciate that and just want to know if there's anything that I can do to help you.
I appreciate that, Daniel. You know, we did take, as soon as we heard about the executive order, we did research and look at what implicit bias trainings. There are different types of training based on the level of staff and their involvement with the community. So we have implemented that. And then, you know, the next step is really looking at as an internal to the organization, our policy. And so we are looking at creating a group of diverse employees to really look at both our policy and the messaging that we send out on our platforms, on our social media sites, to ensure that we, you know, are appropriately embracing the executive order by the governor.
I think that's phenomenal. I really do. And I'm hopeful and looking forward to seeing if we end up with any of our community members on that committee that the governor is creating at the state level. So
yeah,
again, kudos and awesome leadership. And if there's anything that I can help you with, I don't know if any other commissioners had any additional questions outside of that. All right, seeing or hearing none. Thank you very much, Mary Beth. Have a great day.
All right, thank you.
All right. Back to the agenda. That brings us to item D, which is medical care facility. I don't see anybody from medical care facility. I do see her report attached, and I'm not sure if it's just myself, but it is a very blurry mess. And while I could try to read through it, I would prefer to have a clear copy of that, so I'm not getting a headache trying to read those numbers. So I don't know how other commissioners feel. I see a couple of nods from my fellow commissioners.
We'll ask them to resubmit.
Okay, thank you very much.
Resubmit that, and I thought they were going to be here, Deborah. Did you hear anything from them, or?
I did not hear anything. I apologize, but no, I have not.
Okay, well, we will speak to them about the report. Sorry about that.
No problem at all. Thank you very much. Okay, that brings us to item E, Department on Aging.
Danielle, you need to turn your mic on.
Thank you. Sorry. Well, just to start with, I just wanted to recognize the passage of the senior millage. So we were ever so thankful for the community coming around and supporting that and helping us to be able to continue to provide the services to older adults in our community as well as their caregivers. So it was a little bit more challenging with COVID to be able to get the message out about the millage. But again, I think working with the county through Facebook and being able to go on JTV and sending flyers to our clients and the caregivers that use our services now, and just fielding, I think, the phone calls that would come in if people had questions about the ballot, and being able to answer those so that people could make informed decisions. I really think that that one-on-one contact helps as well. So again, we're thankful for the support that we received. To go over the report that I submitted, each year we work with a program called Project Fresh and Market Fresh, and it enables older adults to receive coupon books that they can take to farmers markets that have signed up to participate, and they can pick out fresh fruits and vegetables, even different kinds of seasonings like honey and things like that. And so they get $20 worth, and they can either spend it all at once, or they might spread it out over a period of time and use like $2 each time that they go and get a discount. But this enables older adults to have the products available for them to use in their homes. So we're currently have about 40 coupon books left at this time, and we'll continue to get those out through September. And everybody can hear me, correct? Yes, okay. With senior nutrition, just an update on the boxes. I've mentioned this in the last couple reports that I did. We did go to a new company. Our region is now with Van Eerden, who's actually our food purveyor for Jackson County, and that's working out very well. Our old provider that we received from the state for the boxes was La Grosso. And with the new boxes that we're getting, we are getting 2 boxes now for each person. So it's actually providing more nutrition in the home than what we had before with the other provider. So they're getting a box that contains just fruit in one box, and another box that contains different vegetables. So they're getting a variety of things. I know last week they had corn in there. They didn't have that before. Again, the fresh tomatoes and the green peppers and zucchini, it provides a lot of variety. So the new boxes have been very well received. Because of the size of the boxes, people are more likely to get it every other week. So we're servicing more people, being able to help spread it out. Because it's such a larger quantity, people don't necessarily need it week to week. But again, we have this available in the community for those that are, again, looking for that fresh nutrition to help supplement what they have in their home. Just an update on our personal protective equipment. We've been working with Region 2, and they are helping us to get different supplies. Again, we don't have to pay for these, so any supplies that we can get helps to save us on our budget for what we may need to purchase for our workers in the home. So we're getting a lot of masks, They're the cloth masks, so they usually come like 3 in a pack. They're great for the home care workers, our drivers, our social workers. So we're very thankful for those. They also, gowns were really hard to get. That's one reason we were delayed in trying to put our personal care program into the homes of the seniors. So the gowns that we're getting from the state right now, they're like a one piece. So it's very nice. The ones that we were able to get from Petoskey Plastics, they were a 2-piece. So it takes a little bit more time to put together for the workers when they're in the home. They're also a lot warmer. The gowns that we're able to use right now with the heat that it is when you're in the client's home working, these ones are much easier. The home care workers really like them. So hopefully we can continue to get those as well. With our home care assistance program, we had not been assessing new clients for the program. We were trying to get our current clients back on board, and we had reached that point, and we're now assessing for clients that were seeking new services. And this goes actually back into March. So we're assessing all of those clients now and getting them into the home care services. And so during that period where our home care workers weren't going in the home because of COVID, those new assessments were kind of on hold. But again, we're working through that process now and assigning those clients as we're able to get the workers on board on the schedule with that. So we're excited for that change in home care services.
Can I ask a question?
Yes.
Danielle, if a senior wants to get home care assistance and there's no economic tie or anything like that, all they have to be is a senior in Jackson County, correct? And they can call your office for assistance?
But there is an assessment we do. There is a question about income. That does, play a point factor into it. It doesn't mean an automatic no. You look at the overall picture.
Do you connect them to alternative services if they can't use you?
Yes.
And are those services usually typically paid for by Medicare or Medicaid?
We talked to people about the Tome PACE program as well as the Medicaid waiver and also private duty.
Okay, so you're a resource for seniors to contact if they need in-home care, no matter what economic level.
Correct.
Okay.
I
Thank
consider
you.
that focal point to help provide direction.
Thank you, Danielle.
Sorry, I have a tickle in my throat. Apologize for that. Just a moment of excellence. So I won't read that comment, but again, for the senior that talked about, she was going to bed hungry. That's another reason when you think about why we do the millage. So I thought it was pretty impactful. We received a lot of calls from seniors that were so thankful that the millage passed. So again, we're thankful for the support. And I can answer any questions.
Commissioners, what questions do we have for Danielle today? Mr. Plesky.
Thanks, Mr. Chair. Perhaps it's not so much for Danielle as it might be for the administration. And I'm going to admit my ignorance with respect to the senior millage passing. Congratulations, Danielle. If I recall, that was 0.35 mils. And I'm just kind of doing some mental math. That tells me about 1.6 million roughly incremental revenue by virtue of that passage. Remind me whether that millage will relieve our general fund of some funding for senior services.
Do you want me to answer that?
I'm kind of admitting my ignorance, but in light of a meeting we're going to have in a half an hour, I guess I'd like to know that.
Yeah. Really the millage is going to raise right around 2.8, but we also have grants that we receive of about $1 million. So with the passage of the millage, it does relieve the general fund. So we're more independent. Sorry for the tickle again. So again, there's no general fund going in to support the department now. We will reimburse our expenses in the Maximus reports back to the county.
Thank you, Mr. Chair, and I'm sure this maybe a little bit more discussion of this may ensue at our 1 o'clock meeting, but I just wanted to ask that question. Thank you.
Thank you for that question. I was curious about the same thing myself. Any other questions? All right, seeing and hearing none, thank you very much. And also congratulations on the passing of the millage as well. I was excited to see that pass also. All right, that brings us down to the Health Department monthly report.
Good afternoon, it's Rashmi. Can you hear me okay?
Hi, Rashmi. Yep, we can hear you.
Okay. Oh, let me start my video. You can see my face. All right. Hello, all. On the Health Department report, I'll start off with some of the other program areas that have been working even during this COVID. On the WIC side, we have been doing things remotely, getting people their benefits, getting them their food assistance information, things like that. And we've actually been really busy. On the WIC front, we've exceeded the number of clients in terms of the ones that the state assigns to us, if you will, each month, and averaging a little over 4,000 each month in terms of getting those clients served and for them to receive their food benefits. So that is a good thing that it's keeping our WIC staff busy, but it's also I think a condition of what's going on, that a lot of people are still in need and needing this service. So that's a good thing that we are able to continue providing that. The other pieces on our personal and preventative health services, we have two program areas that work in doing home visits. It's our Children's Special Healthcare Services, which provide services to children with developmental delays and physical disabilities. We've been doing telehealth visits there, and over the time period of June and July, over 2 months time frame, we've done about 10 telehealth visits there. And then the other program for that same time frame is our maternal infant health program. We've done about 116 telehealth services there. So these are also clients that are typically on Medicaid and have a high need, have high medical issues. So it's good that we're continuing to stay connected and help those families there. There are also services that we usually bill to Medicaid. So we're needing to do those in line with the Medicaid rules and regulations. I'll move on to environmental health, just to hit on some things going on in our field services. You see there that we've got our wastewater permitting activity to show that we've had some slight increases in the permits that we've issued there, going up to 111. We had 111, in 2019. And then 105. So sorry, that's actually a slight decrease in the number of permits, but pretty much keeping in the same line of previous years. On the food service side, we've got license applications that have payments that continue to come in, which is good news, being that that's one of our revenue sources. And then we're conducting an audit of our database to assure individuals who have not paid that they have the ability to outline the options for payment that all of you as the board had allowed us to pursue. So we'll be doing an audit to see who that is and getting it out to those facilities. We continue to do education of food service establishments, talking to Laura if needed in terms of compliance, assuring that people are doing things safely, particularly when it comes to COVID. And then we would follow up with the Attorney General's office if needed in terms of individuals having issues with crowd control or wearing masks or things like that. Seasonal pools and campground inspections have been conducted on a normal basis as per the executive order. And as long as they're in outdoor environments, the indoor pools are still closed as per the executive order. We continue to do mosquito and tick surveillance. You may recall a couple weeks ago, we had issued a press release on Lyme disease. So we continue to educate the public on mosquitoes and ticks, and we continue to do our tick drags, if you will. Those are when we try to find out what species are all in our county and what we're dealing with, so we know what kind of potential diseases could exist. The other piece is PFAS. I'm not going to go through the whole paragraph there. I'll let you take the time to read it. But the state has proposed new maximum containment level rules, MCL rules for PFAS. And so those will be going into effect. We do have one identified water supply area in our county, Lomar Machine in Horton, that is affected at this time. They've, been monitoring their water on a frequent basis. And we've identified that the analytes in there are low at this time. 6 are within the state, and 6 are the state has certified 12 laboratories. So we're working with those labs in order to obtain results. Let's see, and then finally,
Question, Mrs. Shotwell?
I do. Rashmi,
Mhm.
when we're talking 1 part per trillion, what level have they decided? And I realize we don't know for sure, but what level have they decided contamination is actually a concern for human consumption when it comes to PFAS?
Sure, I think they look at it, Commissioner Shotwell, also in terms of what they see as a level of concern. I think I don't have that specific level with me here. I can look that up and certainly send it to you by email. But I think the purpose of some of these MCL rules are to do more of a regular testing to assure that the facilities are operating in safe conditions. I'll look up that value for you. I apologize, I don't have that offhand, but I'll look that up and email it to you.
Rashmi, do you know offhand whether the limit has gone up or down?
I would assume down, just because, again, for the safety reasons, but again, I can check on that and let you know. Any other questions before I move on to COVID? Okay, the numbers that you see here are outdated since I turned in my report last. I'll give you the numbers that we have as of today. 691 positives, 313 of those are, excuse me, let me make sure I got these numbers right. 313 of those are male, 378 of those are female, and we have 32 deaths. So within our deaths, a lot of those remain within the older age population, 55 plus and above. A third of those occur within the nursing homes. We are seeing an increase on the number of positives within our 0 to 19 age group. So we continue to keep an eye on those. Those are, again, within our positives. They're not necessarily deaths, but we just continue to keep an eye, particularly with the schools that will be starting up here in a couple weeks. 500, as of last Friday, the 7th, we have 507 individuals that have recovered. On the statewide side, 87,403 positives, 6,249 deaths. On the Henry Ford side, I just checked today, they update this on a weekly basis. They have 9 individuals hospitalized. So that has gone up a little bit. So we're keeping an eye on that and hoping that's not a sign of the second wave to come. That's just a little bit concerning that that's creeping up a bit again on the hospitalizations, although the number is still fairly low considering what we were dealing with in that first phase. Over the past month, we've identified about 300 individuals that are either probable suspect or potential. This, I'll remind you, is during the course of our contact tracing and case investigation. So as you can see, our staff is super busy. And we're sorting all those cases out, getting them to the appropriate counties if they're incorrectly assigned to us, making sure that we filter out the prisoner positive so that they're going to the appropriate facility there. As I mentioned, we're continuing to work with the 12 school districts in our county. It's a really mixed bag in terms of ones that are opening, ones that are going remotely, ones that are doing it as a hybrid. So I'm on a state work group where we've developed a toolkit and an algorithm to help them determine what they need to do when a positive student or a staff is symptomatic within their facility. So we've helped them with some of their documents there. Also working with all of our colleges in the area to determine what's the safest way if they want to return to face-to-face learning. We continue to encourage the social distancing, washing hands, and reporting illnesses to the health department. We continue to see a lot of these social gatherings and events taking place, whether they're social events, sporting events, things like that. So that continues to be concerning. Also keeping an eye on those that are traveling and coming back to our county. The other piece is in the vaccine front. Hearing from the state health department, we don't have a time frame on a vaccine for COVID. However, we're helping to dust off our plans for the flu vaccine, as well as our COVID preparedness plan, and just preparing for how we can promote both of those, and at the very least, the seasonal flu, as we get into that season here very shortly. The other piece I'll just kind of mention is I know Commissioner Kennedy had asked me some questions about obtaining some numbers on our data side. I just want to, let the committee know we're working with getting these numbers just from our management staff. We don't have an epidemiologist on staff, so pulling a lot of these numbers and figures takes a lot of time off the state system. I'm still trying to figure out from Henry Ford or Center for Family Health if I can find out the negatives. I think is one of the things you wanted to know. The other piece was I'm not sure if we're going to be able to easily pull out those that are tested multiple times. As I mentioned, they're connected to a case number, and we're getting close to having 700 cases at this point. So I'll continue to look into that and see if there might be a way we can do that. But one thing to keep in mind is it's the false negatives we also want to be watchful of, because those are individuals that could potentially say they're negative, but then are still walking around the community and potentially spreading. So those are things that we, want to be watchful of. I think that was it in terms of my actual report. Can I answer any questions from the committee?
Mr. Kennedy.
Hello, Rashmi.
Hi, Commissioner Kennedy.
So I don't want it to be a huge burden on the staff. I can pretty get what I need if you can just tell me how many people have been tested in Jackson County.
Got it. Yep, I can get that. I don't want to give you the wrong figure, but I can find out how many total tested from Henry Ford and Center for Family Health. I'll get that figure to you.
And
Are
then-
you looking for the negatives?
Well,
just total tested?
To be honest with you, I'm going to divide out the amount of positives by the total amount of tests to see where we're at as a county for an infection rate. That's really what I'm looking to do there, is to see of all the positive tests that we have, how many total people have we tested? And then I'm also concerned about, are we talking about false positives at all? I heard you talk about false negatives. Are we keeping track of false positive tests?
So again, we as the health department don't have those results, but I can see what Henry Ford or Center for Family Health have in terms of the false positives. I'm not sure if they would have, to keep track on that is the best way to say it, but I can check.
Okay, thank you.
And then I can let you know too, Commissioner Kennedy, that on our dashboard that the state has, our positivity rate is just about 2%. So when you talk about infection rate, really our positivity rate is about 2%, is kind of, the thing that you might be wanting to look at.
Okay, thank you very much.
Daniel?
Sounds like Mr. Elwell has some questions.
Yeah, not to belabor the point on Corey's behalf, but Corey, you're wanting the actual number of people tested, not the number of tests, correct?
Absolutely. That is definitely what I'm saying. I thank you for pointing that out.
Thank you.
Commissioners, any other question for Rashmi? Rashmi, I have a couple of questions before you go. One, thank you for the report. Just want to start by first and foremost commending Matt over in the food inspection department for really being just a great help to the community for an event that was going on that he had to provide some help for. So I just want to definitely pat him on the back, tell him great job, and thank him for the help that he provided. The second thing, I just had a question. I'm just curious, just kind of some thoughts
Commissioner Mahoney.
around the governor's executive order, and looking at the document that you provided us when we were entertaining the thought of passing the resolution declaring racism a public health crisis. The governor's executive order and the document that you provided us, looking at racism, public health. Can you hear me?
It's
Can you
kind of
guys hear me? No?
difficult. You're going in and out,
Lose-
Commissioner Mahoney. Sorry.
Am I back? Am I here? Hello? That's okay. Can you hear me now?
Barely, a little bit.
You know? Is that better now that I stopped my
Yes,
video
much better.
to-
Thank you.
a little better?
Yeah. Mhm.
No problem at all. So what I'm curious, just if
It's
you
not
guys
better.
at the health department have given any additional thought, and I don't know where it's not better.
Mhm. It was
Okay,
better. I think if Commissioner Mahoney's still on, I think I understood the question, if we've given any more thought to the racism as a public health issue. Oh, he looks like he's coming back on. So Commissioner Mahoney, just if I understand correctly, to redirect what you or restate what you said, you want to know if we've done any more in terms of the racism as a public health issue? Is that the question?
Sort of. I'm just curious now that the governor has issued an executive order. I'm just curious forethought on how we can impact those about racism and public health here in Jackson County.
Sure. So as I understand it, the governor has started and developed a leadership council and asked for individuals to be a part of that in order to influence some level of, I believe, developing policies or trainings and things like that, that could be utilized in various communities. So, I understand that's where she's going with that. I haven't, reached out to be a part of all that, but certainly have been working with Henry Ford Allegiance Health. I know their board had met just last week, and I provided some input to being, as I'm an employee of them as well, provided some input to their strategy that they want to implement at the hospital level. They're looking at ways of looking at trainings, looking at ways of, just looking at some internal processes, things like that. And as public health, we certainly were happy to provide them with data. That's our role in the community. I'll be involved in their community needs assessment process here shortly to provide them some of those needs data in terms of disparities and things like that. I think that's where our involvement has been from. I think even as the health department, where we would be willing, if our state partners are extending some offers to do trainings or things like that in our program areas, we're happy to take part in those because we recognize it's important to the work that we do. So I think that's where we stand right now, but we'll certainly continue to look at that as it is an important issue.
Absolutely. Thank you very much for that information as well. And if there's anything that I can do to help and support you, please let me know. And I look forward to seeing something proactive come from our own health department in that means as well. Are there any other questions from any other commissioners? Seeing or hearing none, thank you very much, Rashmi. Have a great day.
Thank you.
And that brings us down to the claims. Just need a motion and support to pay the bills. Darius and Mr. Kennedy. All in favor say aye or show a thumb. All opposed say nay or show a thumbs down. And next item is other minutes. Other minutes that we have are the DHHS board minutes. If you want to take a look at those, and then the September scheduling report is going to be Department on Aging, Health Department, and Lifeways. And that brings us back to public comment. Is there any public comment?
Negative.
All right, thank you, Michelle. And then that brings us to commissioner comments. Are there any commissioner comments? Okay, well, I will take this time to make a comment. Just would like to say formally that I really appreciate seeing our governor take action on declaring racism a public health crisis, and really wish that our board here could have been on the forefront of change in the right direction. And with that, I will conclude the business of the Human Services Committee today. Have a great day.